everybody. Dr. Jacqueline here at the EnVitality Wellness Center, your guys' chiropractor with the Wellness Way in the South Denver area. Let me just slide this. It moved a little bit on me. That way it's not falling over. There we go. So, I am super excited to be coming to you guys today. Our title is You Don't Know What You Don't Know. So today I'm really excited. I just reshot this patient's x-rays of their gut, and I want to do a little case study with you. So I want to go through kind of our patient care with you and how this patient has progressed and why you just don't know what you don't know. This patient had never been tested before coming into the Wellness Way, and we've learned so much and we've gotten really, really good results so far with him. So just to give you guys a little bit background on this patient, we started doing some Wellness Way testing with him back in September. We tested his food allergies for the first time. Back in September, he had only 8 food allergies. So, just so you guys kind of know what he came in with when he came into the office, he came in with a massive history of sinus issues over the course of about 13 years. He literally couldn't make it through a month without having to take a NyQuil or some type of sinus help. And when we tested his food allergies, the reason why there was so few originally, you guys, is because his immune system was so suppressed. When we ran his stool test, we looked at his secretory IgA, and what that is in your immune function is showing that immune system function within the gut. So we are looking at his immune function within the gut, and his secretory IgA was super tanked, you guys. And that means basically he had no immune function in his entire gut happening and the rest of his body. So he's getting sinus infections all the time, definitely was affected by food, but only came back with 8 food allergies. So this is a really interesting case, you guys, of how just having a few in the beginning isn't always a good thing. So we'd love to test food allergies, but for him having so few actually wasn't representative of all of what was going on in his gut. So this is the last 2 months here. So I want to show his 2 months. So basically back in September, and with doing his food allergy testing and his gut testing, we came up with a protocol to really boost his immune function. He needed massive immune help because his immune system was so depleted. So we worked on, obviously, he was very good about his food allergies. We worked on doing all his food allergies. We worked on boosting up his immune function with several different herbs, and he was very, very good patient. He minded all his food allergies. He took all his protocol of herbs the way that he was supposed to. I wanted to kind of check on his progress. We started all this in September, and I wanted to check on his progress in April. So this is when I reshot his gut x-ray of his GI tract again. And what's interesting is his first x-ray looked a little bit more like the one we just took today, where there wasn't a whole lot going on, and that's literally because his immune system was so suppressed. So he actually reported kind of an increase in symptoms in terms of how his gut was feeling. Back in April, he was feeling really bloated. He was feeling like he would start having massive reactions to foods that weren't part of his list, and he was kind of like, whoa, what's going on? Well, you guys can see, so anything that is air bubbled like this, you can see over here, all these air bubbles, and all this stuff down through here, this is a pissed off GI tract. That is inflammation city happening in this GI tract. This is stuff that we don't want to see. The one we shot today, you guys, look at all this clearness. So you can see there's a little guy right there, and there's still just a little bit over here. But the rest of this is super happy. We have hardly any inflammation going on in this gut today. And so literally, you guys, I know these 2 x-rays are only about 2 months apart, but he has been working on all this very, very, very diligently, very hard since September with my full protocol. We've also since tested his hormones because we wanted to see what was going on with his testosterone levels and some of his other things, because you guys, it all links together. You don't get one without the other. And that's why I say you don't know what you don't know. He was basically just thinking that it was all sinus related and it wasn't immune function related. This patient was so immune deficient. If we would have let him just keep going, he would have definitely been prone to things like cancer and autoimmune diseases and all kinds of crazy stuff down the road if we would have let him just going down the path that he had started down. So it's really cool to see all this in motion. And we retested his food allergies about 10 days ago, and now he went from 8 food allergies to 31. And some of you guys might look at me and go, whoa, what happened? That's not good. They're supposed to go down. Well, you guys, he was so suppressed to begin with his immune function. He wasn't reacting to anything. Basically, he had the immune system of a slug. So he could definitely take all the products he wanted to, but none of that stuff was helping him because we actually had to refire his immune function because nothing was happening. So this is a case where actually coming back with more food allergies, that's a good thing. We were actually looking for that because look at how much better his gut looks now. So this is just about 2 months ago, and this is today. So this guy actually improved his gut function. He's improving his immune function. Yes, we have a few more food allergies to deal with right now, but it's actually probably very much more representative of the type of list that should have been there initially if his immune function was normal. So literally for this patient, you guys, all his sinus problems are linked back to his gut, specifically to his immune function. So initially, besides all the sinus infections, this patient couldn't smell on a regular basis. So his smell would go in and out. There would be no rhyme or reason to it. He might have it for a meal and then it would be gone. He might have it for a day and then it would be gone. He could not smell on a consistent basis. So literally, guys, since about right after we took this x-ray, maybe the end of April, for about the last 2 months through all of June, he has been smelling on a consistent daily basis. He's had no sinus infections in like the last 6 months. He's not needed to take a NyQuil since we started doing our protocol in September. So literally, you guys, this patient's whole transformation already to where he's at has been night and day. We've given him back his joy of smelling things. He doesn't have to worry when he flies. He used to have issues when he was flying before, just worried about all that nasal congestion. One thing that I really wanted to highlight that we've added, which is why I did 2 sets of x-rays for him, through a really cool new product that we added. But you guys, this is where I want to harp on you. Not the Dr. Oz effect. Don't go out and just buy this and take it, because you have to use these things the right way. So I want to just highlight the Restore product. So this is something we started with him in April when we saw all this kind of flare up because we had finally woken up his immune function in his gut. So we really wanted to use the Restore product this will actually help to close those tight junctions, which is between the cells. So I wanted to talk a little bit about that and kind of the whole food allergy thing, because that can be a little obscure and not make a whole lot of sense if you don't understand kind of the bigger picture. And that's why too, you guys, again, you don't know what you don't know. If we had not tested all these things properly on him, he could totally take a product like that and it might help for a month or 2, and then he's going to go back to feeling really crappy. So we don't want the Dr. Oz effect in our office. That's why our motto is we don't guess, we test. Because you can have really expensive pee, as I like to put it, and then you can just be chasing your tail and the health issue comes right back again, and you've not really fixed anything and you've spent all this money on expensive new supplements. So that's why, you guys, it takes a doc like me that does Wellness Way protocol to really get in there, figure out the issue, and then actually give you a reason to be taking all these things and roll you through several different things. So this is how, in case you don't know, we want the gut to look like this. You can see this is your GI tract on this side, and then on this other side is where your blood is. So this is that whole circulatory system on this other side. And so normally we want those junctions, they're called tight junctions, between all your digestive cells to be tight. They should be touching so that nothing gets through there. What happens is, because of different things, these are all different stressors. So the three big ones, you guys, are trauma, toxins, and thoughts, which is also a form of stress. So they're all up here, toxins, and then trauma is just another one with what you put your body through every day. Those are the three big ones, but you're exposed to all kinds of stuff as the day goes along, all day, every day. And these can literally, all these types of things can open up these junctions in your GI tract. So you say, well, Doc, how do you start to get food allergies? This is how. Because we have all these stressors on the body, and our body gets to a point where it just draws the line. It says, I can't do anymore. I've done all I can do. So these junctions start to open up, and you've got full food particles getting through that aren't fully digested. And you've got other stuff, like whatever you're getting exposed to outside of your body, going through directly into your bloodstream. And then your immune system has to go and attack all that stuff because it doesn't recognize it. So that's how you start to develop food allergies. And that's also, if you have that go on long enough, how you start to develop immune function issues. Like this gentleman, he was basically right here on step 2. He had massive immune function issues because his immune system was super depleted. And if we would have left him long enough, then you get to number 3, which is autoimmune stuff and other things that start to develop in the body when the immune system is super suppressed, like cancer. Big C word, you guys, as well as chronic issues. This is how all this stuff starts. But notice how it's very simple. So, the cool thing is, I can help somebody down here, even if they're down at that autoimmune issue, or even if they're down into that cancer issue, we can still help those patients to bounce back and to regain their health. As long as we start to discover those triggers, we can start to rebuild the body. But we always prefer to do it, obviously, if they haven't gotten that bad. Because obviously somebody down here, it just takes a lot more work, it takes a lot more time, because it didn't get there overnight. So this, you guys, in case you don't understand, this is a big piece of our health issues right now here in the U.S. We have a ton of autoimmune issues being diagnosed all the time, and a ton of chronic illnesses being diagnosed all the time. So I want to just roll back to his x-ray here real quick. So like I said, we added the Restore product the last 2 months to really calm down his gut. We've retested his food allergies. Yes, they went up, but we know we have a firing immune system now. So this patient, you guys, even though he has a little bit more work to do with just healing up his gut, we know we have finally a functioning immune system, which is what we needed to actually solve his main thing that he came in with, which was his sinus issues. So we've uncovered that rock, we've healed up that piece. Now we're working on the gut stuff, so I'll give another update probably several months from now as we work through some of that. But literally, you guys, it's night and day for a patient like this, and there's nobody else doing this type of testing. There's nobody else digging deep like this. So if you know somebody dealing with something big like this, or even something small, maybe they just think they have some food allergies, I really encourage you guys this Wednesday evening at 6:30. I'll post the link below in the video. We're doing a free inflammation talk. And what that is I go through our whole approach. So like you're seeing with this real specific case study, we kind of talk about how we do all this testing in the office, why it's so effective for a lot of different issues, and why, unlike a lot of other things out there, every single plan that I do is custom tailored to that patient, you guys. Because even if this person came in and he had a brother or a twin or a sister or a mom, they're all their own people. They all, even if they walk in with the same issue, you guys, I can't treat them the same. That's why, again, we don't guess, we test. That's why testing is so important. And all the testing that we do here is not done in typical medical office settings, even in the instance of a specialist. So that, again, you guys, is something that makes us very, very different. I've had patients with thyroid issues, with hormone issues. They'll walk in having seen an endocrinologist, and their testing, you guys, is incomplete. I have like 2 things that I need to know, and my test shows 10 or more. And so that's another big thing here, is a lot of the testing that's done right now in a lot of medical practices, even if it's a specialist's office, is incomplete. So that's what differentiates us. I really want you guys, if you're seeing this, to learn more. So join us on Wednesday evening. You get a free dinner out of it, and we kind of go over all that, like what makes our testing different, what makes our approach so different, why do we get such good results with our patients, you guys? Because literally, this patient, after 13 plus years, do you think we changed his life because now he can smell consistently and doesn't have any sinus issues? Absolutely. And think about all the things that he was headed down the road for, like we were just talking about with his gut issues. He was right here, you guys. So next for him on the health train was some type of autoimmune issue, or maybe cancer, or some other chronic disease, if we didn't actually stop this stuff in its tracks and start rebuilding him. So this is a happy gut. This is what we want our gut to look like. And you can learn all this with just an x-ray. That's why we do x-rays here in our office. This is an unhappy gut. You see all these different air bubbles here and over here. So we're making really good progress. We still have more work to do with a patient like this, but this is what I see every single day in my office, whether it's sinus issues, to hormone issues, to thyroid issues, to gut issues. We see it all, you guys, and I am very, very passionate about helping these people, because a lot of times there's nothing, they just don't know. A lot of times they'll go to 5-6 specialists and they're just like, I don't know, try this, and they don't have a good game plan for them. So if your medical practitioner doesn't have a good game plan for you, if you don't feel like you're being taken care of by your doc, join us on Wednesday evening. Come learn more. And just feel free to comment below, like and share this video, you guys, if you know somebody that's dealing with some of these health issues, because we are here to help them. We're very, very passionate about that. And the cool thing is there's Wellness Way docs all across the country, but if we don't have an office near them, I can work remotely with them. So you don't have to be close to one of our offices to work with me, or if there isn't another Wellness Way doc near you, we can still do all this even in a remote setting. So hope you guys learned something. I'm super pumped. This made my Monday, and we'll be bringing to you guys some more patient spotlights just like this. But once again, to wrap it up, you don't know what you don't know, so that's why we don't guess, we test.